their own experiences of mental or emotional distress. When someone like me can say, I have panic attacks, and know that it's a common experience, is being discussed openly on the airwaves, over the internet, and in common conversations. So more people will feel comfortable to seek help than maybe have ever sought help before. But this new and unique point in history presents new challenges as well. We run the risk of separating out people with experience of a mental health difficulty into marginalization in our communities, into social exclusion, into lives of poverty, into living shadow lives in the community, out of the mainstream of Irish life. And that is where we are at now, when we know that most people with a long-term mental health difficulty are outside the labor force, are not given maybe the same opportunities to work and to earn a living for a good quality of life. We also risk failing to meet the needs of new and long underserved communities who need mental health supports, people from ethnic minority communities who are living in Ireland, people in the deaf community, the traveller community, people who are homeless, people who have a disability. Crucially, in an era where the doors of the asylums have almost all closed, there is the risk of having nowhere to go when someone needs help. And that is a new reality that we are facing now. This new era of openness about mental health also creates fresh challenges for the health system, and which up until now has maybe, perhaps, been focused mostly on people in the most severe distress. Because now more and more people are coming forward to seek help for their mental health difficulties, and they want a good quality service, and they want choices in their treatments. They want to have access to psychotherapy as well as medication, and they want peer support. They want services when they need them beyond Monday to Friday, 9 to 5. They want the right to be able to get a job even if they do disclose a mental health history. They want to be able to get housing so that they don't end up trapped in an expensive hospital bed when actually all they need is a home. And they want their rights protected. They want to know if they end up in a mental health inpatient unit that they can have the confidence their human rights will be protected. It's quite clear that despite the efforts that have been made since publication of the Mental Health Policy, A Vision for Change, our current mental health system is not yet ready for the full scale of these challenges. Last year, we still had a third of children admitted to adult wards, and CAMHS waiting lists were still high. We still have mental health staffing that is about a quarter below what was considered necessary in 2006. Some parts of the health service have been in crisis in the last year or so. We know that since September, the HSE's mental health service for older people in Donegal has been closed and is returning referral letters unopened due to the lack of a consultant psychiatrist. We know that a similar closure took place in the child and adolescent mental health service in Waterford last year. And services are sometimes turning people away who don't fit into the clear service categories. People like those with an addiction alongside a mental health difficulty, for example. People for whom the system is not working to its best yet. 775 million euro was spent on mental health services in 2015, and that's an increase of 89 million euro since 2011, a substantial increase in funding. And this funding is making a difference. We have a counseling and primary care service that did not exist in 2011. We have liaison nurses for self-harm in A&E units. We have more allied health professionals working in mental health teams, by far more than we had, proportionately speaking, than in 2006. But the services are still struggling, as I've described. We have little information, actually, about the scope and provision of the services for that $775 million. We still don't know how many people use mental health services, what treatments they receive, what choices they are offered, how long they wait for treatment, or whether or not these treatments actually help them to recover. And crucially, services still vary greatly from one area to the next. One county may offer home treatment, another may not. One may offer 24/7 crisis support. Another may only operate 9 to 5 and refer people into A&E outside of those times. One GP may refer someone to counseling. Another may not be aware of the counseling service. One service may work well with family members to develop a recovery plan for their loved one. Another may ignore the valuable insights of families living with an individual in distress. So despite real progress, there are still huge challenges to meeting the mental health needs of the people living in Ireland. It is within this context that we come to listen attentively to what the candidates have to say about their plans for Ireland's mental health system. I believe that the next government can take concrete steps to improve the mental health and well-being of the people of Ireland. And our coalition, Mental Health Reform, has published a general election manifesto that offers some suggestions for specific actions. You all will have received a leaflet that condenses those specific actions into some shorthand highlights, and the full manifesto of mental health reform is available on our website. We think it's important that we have a timeline, resourced, whole-of-government action plan to reform the mental health system. We think it's important to build up the capacity in primary care so that the mental health services are not left to try and handle the whole picture, but that there's a robust system of primary care mental health that can help people early on when they're experiencing difficulties. We need early intervention for families where children are at risk of developing emotional and behavioral difficulties. And we need a much more developed school program to build children's resilience. We urgently need to update mental health law so that anyone can feel confident their rights will be protected when they enter an inpatient unit. We need to ensure access to housing and visiting support so people who use mental health services don't end up having to deal with homelessness on top of their mental and emotional recovery. And we need to make concrete steps to ensure that people with a mental health difficulty can have real opportunities to work and enjoy a good standard of living. These are some of the mental health reform as a coalition suggestions, but really, I, like you, am here to listen, and I'm hoping that we will hear some very insightful and encouraging commitments, and I look forward to the debate. Thank you.
Thank you, Shari. Now, this is, we've